you can't quantify healthcare. You can't put it into a time limit. Everybody's different. So we wanted to be able to cater to that. So direct primary care, what do they say? Netflix and Costco of healthcare. So it's a subscription based and you get like discounted pricing.
The following is a Big Sky Economic Development production.
Welcome to The Vault, a Montana-based business podcast where we highlight the people and ideas driving our region forward. I'm your host, Marcel Brewski.
You're listening to The Vault.
Today on The Vault are two very familiar faces in our Billings, Laurel, Yellowstone County community. Katie, I get to see you a lot, which is fun, and work with your dad too. He's been on the pod before, but we have Cole and Katie with Flex Family Health. Welcome.
Thank you.
Tell us a little bit about each of you. I don't know who wants to start. Cole,
Sure.
just
Go ahead,
and
Cole.
like where you
Okay.
grew
Yeah.
up, like the we like a story.
Okay.
Yeah.
Didn't know I was telling stories today, but I'm from Helena originally. So
okay. I didn't know that about
I'm a
you.
Helena High guy. Helena High Bengals. And I'm originally kind of like from the lake out there in East Helena and stuff like that. My dad would be upset if I didn't.
East Helena.
Yeah, East Helena.
Yeah.
My dad would be upset. My dad was a superintendent out in East Helena.
Okay.
He was my principal when I was growing up. So there's probably a little bit of,
Helena High's
I
in
have a
East
little
Helena.
trauma from that. Yeah.
Okay.
Well, Helena High is in Helena. In East Helena, they have a new high school out there.
Okay.
My dad kind of got that rolling. So
Your dad's a big deal in Helena.
Yeah. East Helena. He's a big deal in East Helena. I don't think Helena really likes him because, it's like, he built the new high school and now they're losing people that are going out to East Helena to go to the high school there and stuff like that. But anyways, I grew up out there, so I'd be remiss if I didn't mention that for him, right?
Mm-hmm.
So, but I grew up there and went to high school there, and then I attended Carroll College. So I've been in Helena a long time. I did have a little stint of 9 months in San Francisco.
Okay.
I played baseball for a couple semesters down there. I'm like, yeah, baseball is not that fun for me.
Yeah,
as
it
a
wasn't.
pitcher.
You're like,
yeah.
oh, that's kind of a big deal, right?
Yeah,
like those are wow.
I was a good pitcher. I was into sports a lot, so I was a pitcher, and I was trying to go do something with that. I turned down a scholarship here at MSUB. It was their first year.
Okay.
And they offered me a scholarship to come play baseball here, and I didn't do it. I went to a junior college to try to go big, and then I was like, this sucks. I don't want to sit.
Also,
like,
you're in San Francisco.
yeah, I was like, yeah, I'm not. I had long
It was
hair.
a little gloomy.
Oh, wow.
Yeah, I had
Okay.
really long hair. I just cut my hair too, so it was long before. So
Okay. So we have like,
I'm just setting the picture for all the viewers out there of like, hey,
yeah,
like,
exactly.
I'm describing that long, blonde, flowing hair.
Yeah.
Why Carroll? Growing up because you go to school. You're from Helena.
I'm from Helena. I went to high school with the head coach's son, the head football coach at Carroll College.
This
But
is
anyways,
like a little because I'm a Rocky grad, so I'm like,
okay. So here's
At
part
least
of,
you're not a tech grad,
I know,
Marcel.
I know. I have a cousin.
yeah. So I was playing baseball. I played 3 sports in high school.
Yeah.
So I was a football player too. I loved doing that. And I didn't really, I thought baseball was going to be my future or whatever. And then I was like, like this sucks. I want to go play football. So I was reaching out to Western and Rocky, and I wasn't reaching out to Carroll. My brother played football there actually too. So they reached out to me. Coach Van Diest reached out to me and said, hey, you want to come here and play tight end? I'm like, I don't really want to play tight end, but because I was a wide receiver in high school, but so I did that. And, we were winning a lot of football games and stuff like that at Carroll. So that was good. So it was nice to be part of that. But I went up there, went to Carroll, got into nursing there.
What drew you to that?
My mom's a nurse, and I was in public health, major first. I was kind of, waffling when I was a freshman and sophomore about like, hey, public health, do I want to be like, or do I want to go to health, some sort of health something? And mom's like, well, have you thought about nursing? I'm like, well, not really. But she's like, yeah, I think you'd be great at it. So I guess she was really right on that one. So I got to give my mom a lot of credit for that. But
Thank you, Mom. It's funny how they know things when you don't. You're like, are you sure? And then it happens.
Yeah. And so I got into the nursing program there and I played football. I sat the bench a lot, but it was fun. I did a lot of practicing and stuff like that and got to play some. It was a good experience. I love football still to this day, but went to nursing school there. Katie And that's kind of where our story began, Katie and I, where we both went to Carroll together.
Yeah.
I didn't meet her at Carroll. I met her where we worked at a golf course together.
But you guys
Bill
were
Roberts.
both going to Carroll.
But we were both going to Carroll. But
He's older than me, so
Yeah. I was a senior and she was a freshman, I know.
Oh,
But
it's funny once you get older past 8. It's
yeah, absolutely.
Yeah,
Yeah.
it's fine.
One of those things too where I was working at Bill Roberts golf course. I did that every summer. I
Okay.
stayed there, worked at the bar and stuff like that. So Katie came out there, applied. I was a senior and she was a freshman. I didn't know her, but I was like, we had all these new employees come out and I was like, hey, Katie, you want to sit in the beer cart with me? And I'll show you how to go around, teach her how to do that. And that's where it started kind of. Yeah.
You're
So,
like, oh.
yeah. There were other girls there too. So, I mean,
Yeah, how special.
I had to
huh?
pick the best. So.
Gotta sound good.
But so that's where we had met.
Yeah.
too. So
And I
that's
want to
kind of-
dive into that. But Katie, how did you
Yeah.
get yourself to Carroll?
um,
Like, where did you grow
yeah.
up and all of that? We
Sure.
adore your family. I adore your dad. I just like
I
him
do
on the
too.
podcast was so sweet. He's like, can I talk about my dad for a second? And I'm like, yeah. And yours grandpa. Anyways,
Yeah.
listen to that episode. Brian
Yeah.
Wood, people, Brian Wood. Anyways.
Yeah, that was like one of your first ones almost.
was.
I
It
think.
was,
Yeah. So no, I adore him too. But I grew up in Laurel. If you listen to that podcast, you'll kind of hear the story of our family business out there and what brought us to Laurel,
Which is
we're a manufacturing company called Woods Power Grip out in Laurel. We manufacture vacuum lifting equipment is the technical term. I always just tell people industrial suction cups, to lift glass, stone, metal, a variety of materials, but very niche product. But it's been our family business for over 60 years now and was started by my great-grandfather in Wolf Point. And great story. And like I say, go listen to that podcast to hear the full story. But grew up in Laurel then, was a locomotive, came from that small town kind of vibe. And when you're a small town, it's a blessing and a curse in a lot of ways. So upon graduation, I wanted to get away from the small town vibe naturally, right? So went and toured some bigger colleges, out of state type colleges, and then figured I'd better have like a Montana school though too in mind, just in case. Didn't want to go to the university or MSU just because had a lot of classmates going there, and not that I didn't have a lot of friends and wanted to get away from them necessarily, but just kind of wanted to do something different. So I chose Carroll. We spent a lot of time in Helena up at the lake, and so I was pretty familiar with Helena and Carroll. And like Cole said, the football team was good at that time, so it's fun to go be a part of something like that.
like a good like school spirit, culture.
Yeah, exactly. They have the faith element, which I really appreciated too. And so I went and toured the bigger schools and went and toured Carroll, and ultimately Carroll did just feel like a better fit for me. And so that's kind of how I ended up there, and really appreciate that my story did end up that way. And so I went to school, majored in nursing. I always had the family business as part of my background and story. But again, just wanted to be my own person, do something different. And so I thought, well, anything in health is a great profession, right?
Yeah.
And so I just kind of picked nursing somewhat arbitrarily as a health career path. And I got into it first year or so, and I remember calling my dad and saying, what am I doing? This is a big mistake. I don't want to be a nurse. And he said, just stick with it. Nursing's really versatile. You don't have to necessarily be a bedside nurse. You can do a ton of different stuff. Just stick with it. And so I did. And it ultimately he was right, as he is most of the time.
Again, these parents with their wise words.
Exactly. Yep. And so stuck with it, met Cole along the way. And after I graduated, Cole had moved to Bozeman and had been working in Bozeman at that time. We were engaged already and kind of decided he had been in the Kalispell Whitefish area before that, right after he graduated. And then we decided we kind of wanted to move on this side of the state after we got married. And so we picked Bozeman back when it was still the Bozeman that we all know and love, and lived there. I worked as a nurse there at an oral surgery clinic.
Oh, interesting.
Oddly enough,
Okay.
that was my first and only nursing job was as an oral surgery nurse.
Mm-hmm.
Oh, yeah. We know the stories about that.
Yeah.
I'm like, I feel like I've been a patient for those types of things.
Oh, I was.
Yeah.
And I didn't get any dental work done. So I let Katie, I'm a nurse. I
they
let
don't
people
teach you oral surgery skills in nursing school.
Like to numb
Oh
something.
yeah, she
Yeah.
numbed my, to numb my jaw, but so there's different types of numbing that you can put in there, and she did it. She got it. It was great. Like,
Yeah.
numbed me right up. I couldn't feel my jaw, my tongue, anything over on my right side or left side. I can't remember, but she used I think she used Marcaine, which is a long acting kind of numbing agent. And I was numb for like 12 hours.
Wow. So she did a great job.
Yeah,
Did a
absolutely.
great job. Yeah, exactly.
So I was brewing all this beer that I was brewing beer. So I love brewing beer, and I kind of really got into that stuff. And we were in Bozeman, and I was brewing beer with one of my buddies that day, and I think it kind of threw me off. I screwed it all up. And then I was drinking beer, and it was coming out one side of my face too.
This is not.
This is not good.
Yeah.
So, I mean, looking back, it's super funny. That day, it wasn't real funny.
It was not funny.
No, and like to be good at that, because I'm like,
though.
I've had
Yeah.
bad experiences. My uncle, he's amazing, but I've had some
Uh-huh.
others, and I'm like, this is not enjoyable. But I want to walk us back to the golf course.
Okay. Yep.
So you went to Carroll. We're both meeting at Carroll.
Right,
The
right.
nursing program, I assume, is 4 or 5 years. 4.
4.
It's a 4-year
Okay,
program.
cool,
A lot
cool.
of people do it in 5 though too. Cause
Yeah.
yeah.
That's just how it goes.
Mhm.
What was your thought of it? So you're like, I'm going to get this job at this golf course too. And then this guy comes over and is like, hi,
Yeah.
here I am.
So I got the job. Bill Roberts Golf Course, for those who don't know, is like right next door to Carroll.
Yeah.
Oh, okay. I didn't know
it was
that.
just
Okay.
like super
It's easy.
convenient job. Great job for a college person.
I lived right next door to it too.
And,
so it was easy.
Just
Yeah,
everything
so
is
I-
in like a little circle. Yeah. Okay.
Right.
Yeah.
So I got the job, and I remember the lady who was the manager saying, "Oh, do you know Cole? He's a nursing student at Carroll too." And no, I don't know him. And showed up and didn't recognize him really,
Yeah, I didn't know Katie either.
but he was assigned the task of training me and the other newbies on the beverage cart.
Yeah.
Getting to know the route of the golf course and that type of thing, how to load it and unload it and do the till and all that. And so he was like, why don't you hop in with me? And the other 2 girls can hop in the other cart.
Yeah,
and,
there was, yeah. They
so
followed
yeah,
us around and
so it was
drove
just
around
kind of like,
Mhm.
hey, you want to hang out after work? And
Mhm.
just kind of evolved from there, I guess.
Yeah.
So
We hit it off.
Yep.
But you were
Yeah.
off. You were graduating.
Yeah. So, and that was kind of like one of those things where, I don't know, we had hung out, that summer a little bit, and then kind of made it official, like in,
I don't know.
remember
End of
we were
summer, middle
at
summer,
like a,
yeah.
like a, what's the
Alive After 5.
Alive After 5
Oh,
deal.
okay.
I hate to admit, but I always get the Helena one and the Billings one because one's Alive After 5 and one's Alive at 5.
Yeah.
Oh,
Alive
Helena's
at 5
alive
is
at
Helena.
5. Yeah.
Alive at 5. Okay.
But they're like the same. That sounds
Yeah.
the same.
Right.
Yeah.
Right. Very fun events.
Yeah.
Regardless. Yeah.
Yeah, and we were talking to some people. I will never forget this. It was like middle of summer. One of my dad's old students, and now he's like one of the basketball coaches, and he's telling and stuff like that. Ty Ridgway. I remember going out there, and he's like, "Hey, like, how's it going, Whitmoyer?" And I'm like, "What's up?" And I'm like, "This is my girlfriend." Well, and Katie kind of like looked at me, and I'm like, "Well, I mean, I think we are." And that was kind of like, like that moment where it was like, "Well,
What do you think? I'm
Yeah,
putting you
right.
on the spot in
Yeah.
front
And
of
it was right in
someone
front of-
else.
It was right in front of him too, that we were kind of doing this kind of thing. And I was like, well, I think, right? And he was kind of like, yeah, this is funny. And
Wow.
I'm like,
I'm watching them decide this
Yeah,
on
right.
the
Real
spot.
romantic.
Uh-huh. But we said yes,
yeah,
right?
Yeah.
Okay. Okay.
So-
I introduced her
Yeah.
as my girlfriend, but I was like, well, yeah, I mean, like, if that's okay with you, I didn't really formally ask you that, I guess.
Yeah.
But I just assumed that was the case.
That it was cool. It was
Yeah,
fine.
right?
Yeah. Yeah.
Yeah, it worked out.
Yeah.
So, yep.
So then I think we held
But-
hands after that, maybe.
Yeah.
Yeah.
You guys were official.
Probably.
Mhm. But
So,
you were a senior
Mhm.
yeah.
Yeah.
and you were a freshman.
Yeah.
So I
had
just mean like
finished my
okay.
freshman year.
So
Yeah.
you had a couple more
Mhm.
years to
right.
Yeah.
Right.
school.
Yep.
So,
and you were like, I need a job.
well, yeah,
Mhm.
I was kind of, my life is like getting turned down a lot, so I got turned down from jobs, like, a whole bunch of jobs I had applied for. So I was trying to go to the University of Utah. They had a really good new graduate program that kind of got you into like intensive care and stuff like that. And I applied for that and didn't get there. I applied for some jobs in Helena. They weren't taking people. I applied for a job in Kalispell at the hospital up there, and it was a new grad program, and I didn't get in. So
he wanted to go somewhere like that he could ski and like have fun. And
so Utah, like
stay in Helena with your
Bozeman.
girlfriend, or maybe like
I'm sensing a
so
theme.
Katie
Yeah.
and I have been dating probably for what, a month?
yeah,
Like it seriously was like that. I mean, we had hung out some, like she said, and then it was like that day, that was like in July or something like that. I remember, I think it was like, seriously though, like this is weird. It's like July 14th or something like that, which I think maybe that's just Burke's birthday or our son. But anyways, I remember that. And then I got so I applied to all these things. I'm trying to figure out my life. And then Kalispell calls me back and they're like, hey, like you're on the waiting list. I'm like, oh, I didn't know there was a waiting list. And I'm kind of like, well, this is the only opportunity I have. So, I was like, I'm going to do it. But, we decided to kind of continue what we were doing. And
we said, if it works, works.
Yeah.
Great.
3 hours away.
Yeah.
I mean, Helena's my
That's not bad.
home
Yeah,
too, so going back home is easy. Doing a lot of that stuff, I would come back quite a bit to do that. And then Katie would come up and, we'd go skiing and do a bunch of fun stuff up there too. So it was really, it was great,
It ended up working out really well.
And 3 hours
it was
isn't
a
bad.
super fun time of our life. And
Yeah.
now every time we go from Helena to Kalispell and drive through like the Sealy Swan, it brings back great memories.
I was also in a band. So my buddies in
I'm
my
like,
band.
wow. Okay.
My buddies in the band were in Helena, and they were like my best friends. So, and I lived with them. So I would go back and stay with them or,
And what was your role in the band?
I was a guitar player.
Oh, cool.
I would sing
Okay.
a little bit too,
Okay.
a couple
Okay.
songs,
Cole's got a really long resume.
Yeah.
I'm
sorry.
like, and then did we like working in the hospital in Kalispell, or was that like the side gig that was happening?
Yeah, right. Yeah.
I'm just kidding.
I was
I'm
gonna
kidding.
go big.
Yeah,
I did
Kind
have
of was. I mean, you would work like a few days and then you skied like a ton of days.
Because they're probably like on 12-hour shifts, right?
Yep. I was doing 12-hour shifts, and there was, I worked on a medical floor and a surgical floor basically mixed together. So I was up there doing stuff like that. And then I would be on like 4 on, 2 off, 2 on, 6 off.
Did you like the hospital environment?
It was really good for learning. I think it's something that as a nurse, if you're going to do something like that, or if you're going to have a long career in it, you have to have some experience in that patient care. And I think that's where you see the sickest people, and you see a lot of different things. I transitioned off of that into the ER, that's a high stress environment. But again, same thing. You learn a lot just, being in there, seeing what these doctors are doing, seeing the things that you're doing. It's, sometimes it's a sharp learning curve and you get your butt handed to you a little bit. And I've had that a couple times, but yeah, definitely not my vibe anymore. I started this business. So, it was one of those things where now I'm working more than I ever have in my life and not having as much time to ski. So there is a trade-off, but yeah, definitely working up in Kalispell was good though. I mean, especially when I was on 4 on, 2 off, 2 on, 6 off. Then I went to 6 on in a row. 12-hour night shifts in ER, and that was difficult. I had 8 days off, so I'd obliterate my body going up skiing, having some beers and going skiing, and I skied like 60 days a year somewhere in there. I think it was like 55 days a year.
So we like to ski.
Yeah,
Okay, wow.
Love it. I'm on ski patrol up at Red Lodge right now too.
Oh,
I've
cool.
been there for the last 3 years, so I think this will be my 4th year, but I'm just a volunteer up there.
Yeah.
I like getting away and doing some of that. But my ER experience has really got me prepared for that. So I love skiing. I played in a band. I played sports in college. I'm kind of dude that just goes. I like to do things.
You like to be busy.
Yeah. So after we did all this, we went to Bozeman to continue the story. I'm getting good at the storytelling.
Yeah, you are. But I'm like, Kate, and so Katie's going to shoot. You're like in Kalispell, coming back and forth.
Yep.
Katie's going through. You're doing the nursing. You're like, Dad, you're right. I'm in it.
Right. Yeah.
And so you just finished your 3 or 4 years out after.
Yeah, just
then-
finished it out. And,
She lived up in Whitefish with me for. I know
a
we
summer.
can say that now.
Yeah.
Did you work? Did you?
She was a CNA.
I worked as a CNA between my junior and senior year of college. So
on the floor that I used to a lot of the time.
turned
So,
in my golf course job, went up, did the
Yeah.
CNA thing, got some nursing experience,
Yeah.
so to say.
And Katie and I, the cool thing about Bill Roberts is we got to golf. So when we were dating and stuff, we would golf a lot too. It was fun, you know. And then when she came up and lived there, we had memberships. It was great. $500 for a ski
live in the
pass,
city.
and then $500 for a golf course
That's not
membership.
bad. Yeah.
So
Yeah.
you know, it was awesome. So I mean, we skied and we golfed and did all that and just kind of
Active.
played and had fun. And then in that time too, I was learning how to brew beer because I was like, I just
Just
want to
for
make
fun.
my own.
Yeah.
You know, there was a cool brewery there, Black Star. It's now like,
It was like,
I
is
think
it still
Jeremiah Johnson now.
Okay.
It's really cool.
Yeah, it's awesome. It's a really
In Kalispell?
yeah.
Whitefish.
Oh, Whitefish.
Whitefish. Okay.
The
okay.
tallest building in Whitefish, I think, or something like that.
Yeah.
they
is the
say.
brewery?
Yeah.
Wow.
But it's like 3 stories.
It
It's
was
really
at the
cool.
time, at
Yeah.
least. I
They
don't
got
know.
a great view of the mountain and stuff. It's really cool. I love that area. Have a lot of good friends there, so we try to make it back there as much as we can. But anyways, so I started learning how to brew beer there, and then Katie and I, you know, Katie was graduating. We wanted to be closer to home, so we moved to Bozeman. I got a job there in the ER, and I
Is
live
this
with
where
my,
the oral surgery?
Yep.
Okay.
Right.
Okay.
Yep.
I lived with my grandparents for a little while. They lived in Bozeman, so Bozeman is pretty close to my heart. My grandparents lived there for a long time.
And close to Helena. It's like right there.
Yeah, it's easy.
Yeah, it's easy
so
to get
we
to,
were
yeah.
easy back and forth, stuff like that. It was great. You know, cost of living there was tough. Then
Yeah.
same thing. You know, Katie and I were just hanging out. She was working at the oral surgeon's office. You know, we bought like
By
a little.
this time, we had been married, and we.
Oh, yeah.
So
2013.
Okay. So we were okay.
So he moved down to Bozeman while I was finishing my senior year, and that's when he lived with his grandparents and got a job in the
Thank
ER
you for
there.
these details.
Yeah,
We did get married.
yeah.
Sorry.
We're all,
I'm
but so
bad at storytelling.
It's good. No, like
so he
that.
did
You have to.
that, yeah. And then he kind of decided he wanted to apply for MP school
Which
during
is
that
nurse
time.
practitioner.
Nurse practitioner.
We
and
gotta tell them we
so-
got married in 2013.
Yeah,
here in Billings.
Yeah,
We
yeah.
went to
How did you
Details.
ask?
So
Like
What?
when?
6/22/13.
that's our wedding.
That's our wedding. That's our
How did you
anniversary.
propose?
How did I?
Yeah.
Oh yeah, we got to do that.
Yeah.
So Katie and I went on a road trip. I'm like
Okay.
20.
You were probably like 23.
Yeah, and you
I
were
was
19.
like 20.
Yeah, we were
or-
20. So she's
yeah.
not 21 yet. So we're
Okay,
trying
okay.
to
Yeah.
Yeah.
go
That
do
you
stuff.
gotta-
We went on a road trip.
For spring break down to California.
Oh, that's
Yeah.
fun.
So we went down to Utah. We stayed with one of my buddies there, Stevie Sloan. He's from Billings here, but he was also a man nurse at Carroll with me. So we went and stayed there with him. We drove over to California,
Sacramento.
Sacramento.
Oh, fun. Okay.
Drove through the curvy roads. We both got sick. She drove one day. I got sick. I drove one day. She got sick, just going through like the Redwood area, like on Highway 1 or whatever. But anyways, so we went to a Keith Urban concert. Big Keith Urban goers
Okay.
here.
Yeah.
We liked it.
That was kind of a mutual thing that,
Yeah.
like, when
So
you're
you're like,
dating,
okay,
like,
yeah.
oh, we both love Keith Urban.
Yeah.
I like Keith
He's a
Urban.
Hey, he's
sweet
playing
guitar
here.
player.
Yeah.
Like I love guitar. Like he's like amazing at that. So I was always like, yeah, like that's cool. Had the long hair too, you know. So we went down there and we went to a concert. I had bought a ring and proposed to her at the concert. You know, so
Yeah.
Fun.
that's pretty
There.
cool.
Did anyone know?
and-
Did the family know? Like, or was it a huge
Oh
surprise?
no, I asked.
Oh, okay. I was
asked
hoping you did. I
Brian
didn't want to put you on the
and Lou.
spot.
I
And then
asked
you're
both.
like, no, I didn't. And
Yeah.
I, you know.
I asked Brian and Lou before I
Yeah.
did that. I was like, hey, this
He was a
is
good boy.
yeah.
So-
But yeah, no, I told him about that. It was pretty cool.
Aw.
And then because that story
and I
does
was still in
segue.
school, yeah, for a couple of years. So we were engaged for the majority of the time when we were doing distance. But then, yeah, when after I graduated, I think I graduated college in like May or whatever, and in nursing, you have to take your NCLEX, to your boards to get your license to practice as a nurse. So then I studied for like a month while we were still doing wedding prep. So then we got married on June 22nd. I took my boards, my nursing boards. We bought our house in Bozeman, and I got married all in the
Wow.
same
Yeah.
week.
That's a lot.
Yeah, in
It
the
was
same
a
week.
busy week.
Yeah.
I feel like now anything you do,
Yeah.
you're like, I got it. What do you
Yeah.
mean? Like, I
Right.
took this hard test because those are really, my cousin's a nurse, and I remember
Mhm.
when she was studying, and I'm like,
Yeah.
Yeah.
"Ugh, I'm glad business students
Yeah.
didn't have to do that because I'm like, I
Yeah.
don't want to do that.
It's not fun, that's for sure. Very stressful.
well, then you're
Yeah,
planning a
but-
wedding.
Yeah,
When you're buying a
yeah,
house, like
yeah,
there's just three
no
big life
deal.
event, and you graduated
Yeah.
college. It's like just stack it on.
Yeah, let's just get it all done.
Mhm.
So, yep. So then we got
That's our
married.
story.
Yep. And then
Mm.
moved to Bozeman, and I worked at the oral surgery clinic, got that job. And Cole was applying for MP schools.
Yeah, because I hated my
And,
life at that point. I told Katie, I was like, I'm quitting nursing because I just can't do it anymore. Just, it's stressful.
Mhm.
I went to Bozeman. The ER just got this new ER, and it was, I had like 6 patients in there sometimes, and there was sick ones, and
Yeah.
it was just, not what this is not good, safe. Like I'm losing my mind.
And you were ER primarily.
Yeah,
Okay.
all ER.
Okay.
So I was like, I'm either applying to NP school, like, and gonna do it my own way, basically, or I'm gonna quit and be a brewer and make beer for a
Yeah.
living. So again, rejection. I didn't get into any of the schools. We went down to Denver and stayed with Brian Sloan, Stevie's brother, and went to went there to interview for NP school there. Didn't get in there. So I was like, you know what? Like, I think I'm just gonna quit the ER. Like, and it was like this day. I applied for a job, had an interview at Bozeman Brewing Company. Like, there's like, they have a cellar job. It was like $10 an hour. I'm
In
like,
Bozeman, yeah.
yeah. And I was like, sure. Like, I'm applying for this job because I'm going to do part-time in the ER. I'm going to do this. Cause I just, I feel like a wreck.
You
know?
need something different.
Yeah. Like I interview, and this guy's like, you are way too overqualified for this. I'm like, you know what? I don't really care at this point. I love making beer. I love doing that. I love to work up to doing something else. And I was looking for jobs like that. I was talking to one of my buddies in Helena, Blackfoot, like, hey, we have a cellar job. And I'm like, I'll come back. I don't care.
Uh-huh.
And like a day later, like MSU called me, or maybe it was the same day I had an interview. MSU Bozeman called me about, hey, like you're on the wait list. I'm like, I was on the wait
This
list.
is a
huh?
familiar story.
Yeah, on the wait
Heck
list
yeah.
again. Yeah, so I'm like, all right, like you got like a couple days, and you got to let us know because it was like a Wednesday, and I'm like, we got to know by Friday, so we can move forward. And I'm like, well,
TikTok.
Why not?
yeah.
Wow,
and Katie and
yeah.
I are like,
And you're
you know,
living in Bozeman, and
yeah.
so okay.
Katie's got her oral surgeon job. I was moving into like some part time in the ER.
Mm-hmm.
I said I wanted to do that, and then I was like, all right, I'm going to do MP school, and it was, again, it was starting in like a month,
Mm-hmm.
So I'm like, okay, like I got to figure that out, and I just was like, you know what, like this happened for a reason, I'm going to do it, and then I got into NP school in Bozeman, and Katie worked. We lived off of her job. I did some part-time stuff in like clinic. I was trying to get some clinic experience of what I was doing as a nurse.
I would
You
imagine
had to
that
do a lot of clinicals though
Uh-huh.
and stuff too.
Yeah.
And
that it's a pretty demanding because
Mhm.
isn't it like it's not that long of a or how many years is
So
it?
I have a doctorate, and they changed that to where they weren't doing a master's anymore. That was the first year that they were only doing the doctorate program. So it was just 3 full-time years.
Wow.
So
Cole's part of the first graduating DNP program
Yeah.
class at
Wow.
MSU.
Doctor of Nursing Practice. So I don't go by doctor though. I just go by,
Yeah.
unless it,
Cole.
yeah. Yeah.
Wow.
Unless I am in like a very formal setting, like I will do that. But anyways, but yeah, so
So it's like really full time. Like you really
Mhm.
kind of just have to like, which thankfully you're married and
mhm.
you guys can kind of share
yeah,
that.
we
a little
owned a
bit.
townhome,
Mhm.
and bought that.
Yeah, we were very fortunate
Mhm.
that at that time Bozeman was still relatively affordable,
Yeah,
and we found a
relatively.
townhome at
Mhm.
a price that we could afford.
Yeah,
Yeah.
yeah.
And we thought, let's make this investment,
not?
and so we did.
Yeah.
And then when we ultimately only stayed in Bozeman for about a year after we got married. Cole's program could be online. He could do it online or
I had
remotely.
to come back for some things.
He had to come, yeah.
Mhm.
But we got married and we're there for about a year, and then we kind of, Dad called me up one day and he said, "Hey, if you want to come back, I've got this opportunity. I need some help in my human resources department." And Like, I don't know anything about human resources, Dad. I don't even hardly know what that means. Like, what do those people do? But we kind of thought about it and talked about it. And, we had been married and we said, well, we want to start a family someday. It might be nice to be close to parents. So, let's do that. Let's make that jump. And we did. Yep. And it was kind of sad. We had a ton of fun in Bozeman and, my job wasn't bad and Cole was in school and stuff. But ultimately, it was long-term, the choice that we need to make in good timing for it. Mm-hmm. And so we came back and we rented our house in Bozeman for a year. And then about 2 years later, COVID hit and we were like, we had sold our house at that point and thought, oh, why did we do that?
You could have sold it for a lot.
We could have put up our house here now.
Which
COVID was several years after that. We sold it in 2016?
We sold it 2016 or 2017, somewhere in there, I guess. So, yeah.
But still, it was a couple years later of that, even before COVID, where it was like, well, it was like, you could have sold that thing for like $600,000. I'm like, well, that could have.
Wow.
Yeah, that would have been nice. Well, we sold it for a good profit and paid off most of we were paying for my school while we were going there. I got some grants to go to school too. But then afterwards, we sold the house and we just paid off the rest of my loans and stuff like that.
Which was a great decision. Very blessed to be able to do that. Yeah.
And blessed to, that there were grants like trying to get people to go into work in rural areas. So all of Montana is rural, right? Yep. So...
and were you in hospitals a lot, doing a lot of clinicals through the NP program or DNP? What?
Yeah.
Either.
Just NP's good, but but yeah, no.
I want to give credit where credit is due, so I don't want to be.
We're all nurse practitioners. We all have different experiences, and one of those things too, where I think we're all in some sort of playing field. So right, like some of us have strengths and some of us don't. So doctors, like physicians and PAs and nurse practitioners, we all have our certain experiences. So, I think healthcare is an experience-based profession. So definitely one of those things where that's where it's like, doesn't matter what your credentials are. It's more important of how you're treating people and, how you're using your expertise and stuff like that. So I think, and I have a great group of people, which we'll get into in a little bit here, I'm sure, but that really buy into that. And I think that's something in healthcare that we're trying to get, more people to buy into that. We all have our strengths, play your strengths.
I like that.
So doctor, to CNA, we all have our strengths, so.
And you need
that's why I don't have any head on, like a big head about, my credentials or whatever. It is what it is, but just so, we're all on that same page.
Yeah. So you guys moved back to Laurel.
Yeah.
Right. And then you're like,
what?
I also am like, what is human? Like in college, I was like, oh, maybe I'll do HR. And then I learned what that was. And I was like, no, not for me, but for others.
People all the time though, Marcel.
I know, but it's so different than HR.
Sure.
Yeah.
But
it's
so you came home and you're like, okay, bye medical.
Yeah.
For a while.
Yeah. I was like, I'll keep this in my back pocket, but Dad needs some help here and seems like a good fit for now. And, Cole's in school and we need a good, stable job. And,
we lived with their parents too.
We lived with my mom and dad for a year or two. And, came back and kind of learned the ropes. I was very fortunate, because at Woods Power Group, we had a HR manager and his plate was just overflowing. And that was kind of why Dad, asked me to come back and help. And he was an awesome mentor for somebody who had zero HR experience. I got to give a shout out to Don Hayes because he was great. And, I wouldn't be in this role or anywhere near where we're at without him.
He was a lawyer too and just super smart.
And Yep. And so taught me a ton, not only about HR, but about like how to have that brain, that legally thinking brain. So,
which you need in HR.
Right.
Yeah,
well, you hope you don't, but sometimes you do.
Right. Exactly. Yeah. It's better to just be proactive about things. But, so and along the way, I kind of came to appreciate HR more and more and appreciate it with my ties to nursing because HR is human resources. Your whole job revolves around humans and serving humans and helping them and forming relationships. And so I tell people all the time, I still get to use some of my nursing skills and background in that role because, I like to make people feel good about what they're doing and showing up to work and feeling supported in their workplace. And so that's my job as a human resources manager now. So I'm not working as a nurse, but I still get to do the best parts of nursing, at least to me. So
You get to work with people.
Right,
and help them be
exactly.
successful. And
and collaborate and, just don't have to do all the stinky, dirty stuff.
exactly.
anymore.
Numbing of mouths, et cetera, et cetera.
Handling needles and causing some pain to people every now and
Yeah,
then.
exactly.
For good things, right?
Right.
Yeah.
Right. Yep.
And so you guys liked Laurel, so you're like,
Love
okay,
Laurel.
you graduated, right? You're working at Woods at the family, which is fun, with family business.
Yeah.
So I didn't graduate when we moved there. I was still in school.
Yeah,
doing
so you're
that.
like finishing, right?
Yep. I worked, and then I helped them. I helped in Laurel. It was High Plains Brewing. I helped them start that, and I brewed beer there. So I got to do it. I got to do what I really loved to do at that level that I wanted to do it at when I was kind of really looking for that. So it was great. When I was in school in Bozeman, there was a brewery there that like I would go study in there, and like because they would just be brewing beer, and so I'd do my study. I'd work for like 3 or 4 hours, and then I'd get done with that, and then they just let me help them. Like I was free labor. So
you're
I
like
got
learning
an
something.
apprentice.
Yeah.
absolutely, yeah, I was,
Unofficial.
yeah, and so then I moved back here, and then went and helped.
You kind of did that just to kind of keep busy while you were doing school, something to do because you didn't get like a nursing job
No, it was
like you
just,
had in Bozeman while you were in school. So
yeah. So I did that for a while. So that was one of my other, one thing that was like really kind of like, that's what I wanted to do, and I got to do it. So I'm very thankful for that. So
then you graduated and worked at.
Well, we had Vaughn. We had our first son,
that's
like
true.
right
I
before
can't forget that, I guess, right?
Yeah.
Little baby. I
we
won't
have-
tell him.
Yeah, Vaughn and Burke are our two boys. We had Vaughn
Right before you graduated, about 6 months before.
Yeah, 6 months before I graduated. So it was stressful. You
Yeah,
know?
you're just like, it's like, but you don't know any better sometimes, right? Not, I mean, like, as in, like, life's just, there's like a lot that always goes on.
Right.
Yeah.
I think we drive our families crazy with just how much we take on our plates and just we're like, whatever, let's just do it. We just go and,
Yeah.
but
I think
that's right.
Parents think we're a little bit nuts.
We're not the sit at home, watch TV type people.
No.
But yeah, so we had him, and he wasn't a great sleeper either, so that was tough, but got through it and graduated and started working. So Katie was working at Woods, and I started working at a My Care clinic here. So they, the school district.
It's an employer-sponsored clinic, basically.
And I kind of knew that because Woods Power Group had this clinic. And so did the Laurel School District and a couple other businesses in town. And I liked it because I wanted to do that. I started working 7 hours a week or something.
And
one clinic day. I didn't want to go to the hospital, and their pay was like, I was like, man, I was making more as a nurse in the ER than I was like, go to work in their urgent care as a nurse practitioner. I'm like, you know what? I'm just not doing that because
he had experienced the burnout involved in fee-for-service healthcare and just kind of was like traumatized and didn't want to go back to that. And so the My Care opportunity came up, and even though it wasn't full-time, it was kind of like, let's just jump into it, and hopefully it'll evolve into more full-time. And it did.
And thanks to Katie, because she's been very patient with me, because this was something that, it was a strain on us too. And I know that, Katie was working hard. She was full time. She was doing everything. We have, children. I was, taking care of kids and stuff like that too. But, it was like trying to get more hours doing that, trying to make a living. And, the Larson family, I have to shout out to them because they stuck with me. They, when they owned EBMS and, so they owned My Care. So I was there, and they, were like, yeah, let's get Cole. They knew I was committed. So they got me going there. And as time went on, it did transition out. The Larsons transitioned out, and then a new company came in to own EBMS. And I was kind of like, starting to get just a little different, and I was like, you know what? Like, I've been, and we had to start doing things again that was similar to the hospital stuff, where like, hey, you have to put this code in and do that and do all these things. And I'm like, okay, like I want to take care of my patients. I don't want to do that. People leave here, like leave EBMS, and then I can't see them again, even though I have like this great relationship with them, you know, and we're taking care of a lot of things. And, you know, like a patient who's suicidal or something like that. And I had that, I remember that specifically. It was just like, you know, I'm kind of at wit's end, and they lose their job and they're done, you know, and I'm like, well, I'm just going to keep in contact with them, and I'm not going to charge them, and it's my license. So I'm just going to keep talking to them, and I'll prescribe them medicine, you know, and I'm kind of like, I don't know what that looked like. But then after that, you know, I was kind of like, I gotta figure this out. I want to do it my way, you know?
Yeah.
So
how did we?
So I had to convince.
I want to quit and start my own business.
Yeah. So Katie's like, you just got stable. Like, I just got full-time hours. I was like, you know, doing a lot of different things. You know, well, I had full-time hours before that. Then that transition happened, you know? Yeah. And then so I was kind of like,
Kid heard a direct primary care kind of, and, you know, and it explained it to me. And I was kind of like, yeah, that does make sense. Like,
no, you didn't say that. You said,
no, I
said, I don't know about that. And then she's
I
like, I heard about that on a podcast.
Quitting your
yeah,
job.
like that's a big
stuff.
life, right? Starting a business is a big life choice, and you're like,
I was trying to. So it did take me some convincing though, because you know it was new. It was this new model, and I was like, I want to do like a just cash pay clinic. I just like, I remember reading it after I got out. I'm like, this is what I want to do. This guy was like charging $45 a visit, and I was reading this thing. It's like when you have both, like you have someone like one of the richest people in the world in your clinic, and then you have like one of the poorest people in the world, and they're sitting in the waiting room together. Like, it's like, you've made it. And I was like, that is what I want to do. I want to be able, and not saying, I just want to be able to take care of everybody and anybody who wants to be cared for. And so I saw this model. I did have to convince Katie because I told her about it a couple times. And she, Katie loves to listen to podcasts and stuff like that and people talking. So, it was a few months. I think I started this talk in March. I'm like, I'm going to do that. I'm going to get a business plan. She's like, I don't know. I just don't know.
I just didn't want you to like quit your job that you had just gotten stable.
And it's like, is this really what we want? Like, let's make sure it's,
absolutely.
It's not just like, I want to do this today.
No, I'm not saying anything because I feel like Katie's always been supportive of me and everything like that. And I wouldn't be here without her. So I just have to throw a little shade on her, just a tiny bit.
Yeah, I feel like where would men be without their wives?
Yeah, absolutely.
Nowhere.
And
nowhere. Let's be real.
And I tell everybody in my life, I have a lot of ideas. Yeah. Not many of them are good.
But some.
I have to listen a lot. Being married, I listen to my wife all the time and what she says.
Your wisest counsel.
Yeah. Well, I just have to because she's like, this is what we're doing. I'm like, okay.
This is what we're doing.
And then 5 minutes later.
Right. Wait, what were we doing?
But you clearly move forward.
Yes, absolutely. So a few months go by and Katie's like, have you heard about this on this podcast? I'm like, that's what I'm talking about. That's what I want to do. And she's like, okay. Like then she kind of got on board because she's like, okay, this is a thing. And there weren't many of us in the state of Montana doing it.
Yeah.
Or
no one in Billings.
So we go on a road trip. We go to Whitefish to meet some people. We went to Missoula and Polson. We were going up to Whitefish to meet some friends too. So it was kind of like I stopped at all these places and had meetings with all these doctors and PAs and nurse practitioners that were already doing it, this model of direct primary care. So I have to I'll preface that too, because it's different. The way we practice healthcare is in the direct primary care model. So that's what our clinic is based on. So instead of, Katie had mentioned fee for service earlier. So fee for service is basically you go in, you pay for that visit or so whatever, and there's a lot of insurance that's involved. And the problem with that is
a lot of paperwork and that type of thing.
If you want to get paid from an insurance company, you have to make sure you have the right coding. You have to make sure you bill correctly. You have to make sure that you have all these different triggers in a note that you're writing about your patient to be able to maximize your income. If you don't, then you're not going to get paid for this. If you code wrong, you're not going to get paid as much. If so it's
an office visit isn't just an office.
Yes, it's a hot mess. So they have this whole coding system, and basically what has to happen is you have to see if you want to make a lot of money, you have to see 25 people a day. I mean, and
quick, not like
yeah,
one-on-one
it's like
relation.
boom, 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 boom. Your relationships aren't great. This is, and it's being pushed more and more. So, I can't remember what percentage of physicians are owned by another out that aren't private in the country, but it's like, I think it's above 80% or something like that, owned by a hospital system or whatever, owned by, like CVS and stuff like that, insurance companies. So, you are basically cog in the wheel. So you have to, they're like, hey, you need to see this many people. And so,
you
you're
didn't
not,
want to do that.
I'm not doing that. I don't want to do that. I've seen how people are treated, patients. I see how providers are treated, NPs and physicians. And
I think it's important to say that it's not a result of any one easy to identify.
Absolutely. It's a terrible system.
It's just a result of a system that's, could use some overhauling and
absolutely.
fine tuning. But
and
there's a lot of great, people that work in hospitals and a lot of great physicians and providers and nurses who work in hospitals.
And I was just getting to that too. Like it's a bad system. There's tons of great people.
And then you have
in
big
it.
pharma and it's like insurance companies. Yeah.
It is a big mess. So, that needs to be fixed. And I'm not going to get into that, but what I do is direct primary care. So I don't take insurance. That, if you take insurance, you have to have a biller, you have to have a coder, you have to pay all these people to do this to get your money. So your overhead's higher. You have to have several other staff to be able to room patients, and you're popping around and, seeing people and doing it quick and,
And then you only get X amount, as the entity.
You have no life. Your patients hate you sometimes. You find this, and I know there's great doctors out there, and they're like, he sucks. Like, he only took this. I'm like, I don't think he sucks. I know this person. He's a really great person. It's just the system is making that horrible on everybody. And these people go home at 8:00 at night and they still have work to go back to at 6 a.m. to try to finish before they start doing it all over again. So it's a vicious cycle for everyone.
And so that's the problem that you saw, and you're like, I want to do something different.
Yeah, I don't want to be burnt out. I want to take care of people. I want to take my time. I mean, and I always say it to my staff, you can't quantify healthcare. You can't put it into a time limit. Everybody's different. So we wanted to be able to cater to that. So direct primary care, people pay a monthly membership fee and they come in as much as they need to. They can text me or call me 24/7. They come in as much as they need to. They wait in our waiting room for 5 minutes and they get to see me for 30 minutes, 60 minutes, 2 hours. We don't, we try to set those up. We know our new patients come in, they need an hour and a half probably. That's like unheard of in healthcare. Like you would, if you did that in healthcare, you'd be billed like $1,500 for that visit. We just, our monthly membership fee for adults is $69. And then if you come in twice that month, great, no extra cost. If you come in, twice in the year, no extra cost. But one of those things where people can come and go as they please. They can text you. You don't necessarily have to come in for a visit. We can get people in same or next day. We can guarantee that because wait times, I've had people waiting, they're like, I could get into a primary care in 6 months.
Yeah.
I'm like, well, we can get you in tomorrow if you'd like to. And they're like, wow, that's crazy. And they're like, this is too good to be true. And I'm like, well, it's not when you structure it right. Yeah. A yearly cost, sometimes that can add up, right? You have a family, we have family rates. It's $174. But if, two family members are seen twice that year, it's like you're breaking even. With this type of stuff too, in our clinic and what I believe in, we don't have a receptionist. We have MAs, nurses. We have every single.
All the staff is clinically trained.
We have an MA, we have an LPN, we have an RN, we have NPs, we have DOs, we have every type of healthcare provider in there, but we don't have anybody that's not trained in healthcare.
Yep.
So those are the people answering the phone, which they answer the phone, but everybody just call you, text you on your cell phone.
Which
right?
is kind of nice to just be like, hi, I just need this. Like, I'm not.
Yeah. And when people know that you're available, then they don't bug you that much. They're like, oh yeah, like I know he's probably spending time with his family. And sometimes when people need something, they need something.
Yep.
So they'll call you. And I've had to go in for a few visits after hours and do that, but they need you and we keep them out of the ER and we take care of people that way. The premise of direct primary care is this monthly membership fee. What do they say? Netflix and Costco of healthcare. So it's a subscription based and you get like discounted pricing. So I can get we give everybody a yearly lab panel at no extra cost.
Wow.
We give really big discounts on like an x-ray costs $65. So like we can get a chest x-ray, 2-view chest x-ray for $65, 3 views of your wrist for $65. It doesn't matter. Like some people charge by view, they can get up to be like, above $500 for just like a 3-view of your wrist or something like that.
You need, right? Because something's going on or whatever. What if you do have someone that needs like surgery or something? What do you have a referral kind of?
And we, I usually preface this when I'm talking about direct primary care, but we're not an insurance, even though it's this, monthly membership fee. We don't pretend to be insurance. We say people should have something like a health share or an insurance over top to take care of like, hey, big things, catastrophic things. But yeah, if someone does need a surgery or something like that, we refer them. A lot of our patients, we have a big mix of people have insurance, people are uninsured, people have health share plans. So we try to be mindful of those things. And, I think it's up to the patient to decide what their risk level is. But if you need something, it's like, yeah, you probably need this done, and depending on what they have going on, they'll do it or not. And if not, we're there to just try to basically like, hey, you need a knee surgery? Like, well, we can do some cortisone injections into your knee or something like that. And we can do that, $25 for a cortisone injection in your knee. There you go. Yeah. Like maybe we can get you by for a few months. But, everything is becoming so much more expensive in healthcare and stuff like that. It's difficult to get people sometimes things that they need.
And it doesn't feel like, and just, it seems like what this is too, it's more preventative also. So it's like, not as like, I'm only going to the doctor because no one I mean, I guess I do not enjoy going to the even for like an annual visit. So I'm like, I have to go to the hospital. And it's not like a bad, it is what it is, but it's like, sometimes it feels like, oh yeah, you just kind of go through these things instead of looking at it like also some preventative care also.
Yeah. And I think that's where we kind of lack a little bit. When we don't have enough time to talk to patients and be like, yeah, you need a colonoscopy. Yeah, I need a mammogram. Now, you need a pap smear. Yeah. It's like, well, let's talk about why. Let's talk about, let's take at least an hour to have a conversation. Maybe we're talking about your family and stuff like that, but get comfortable with me. Let's talk about like preventing this. Let's talk about like, hey, you've had 2 heart attacks in your family. Like we got to watch that. We don't want that to be the case for you. So that's why we watch your blood pressure. That's why we watch your blood sugar. That's why, we're doing all those things. And, cancer's prevalent. So that we want to make sure that we're watching those things too. I get it. It's uncomfortable to do a lot of these things.
But you want to at least know why, right?
Yeah, absolutely.
Because if you don't work in it, I think, because I worked in dental a little bit too in college, and I feel like really good in that. I'm like, I understand because I worked on the back end of it where I'm like, these are why you get these types of treatments, right? But I think, for medical, unless they're sitting down and really like talking through all of that with you, you're like, you don't leave feeling great because you're like, why do I need that? Am I okay? Am I dying? I don't know.
Yeah. And I think that there's, like I said, when I made it, did I have every type of person in my clinic? And coming with that, which we do, we have like just a wide span of people in our clinic, which I love, from different socioeconomic backgrounds to different socioeconomic to personalities to different, so everybody's different, right? So you have to make sure that you cater to their needs. Like maybe this person has a higher level of education, understands what you're talking about. Maybe this patient doesn't. This person needs more time just on the basic things like that. Or, this person needs to be like, you don't need the most expensive thing in the world to make sure that you're okay. There's a lot of gamesmanship in what you're doing, I guess. And, just trying to understand people.
So much of healthcare and people's experiences feels so canned these days and scripted. And, when you're talking about referring people for preventative things, a lot of times people not only don't understand the process or procedure or the why behind it, but in their mind, they're thinking, how much is this going to cost me? I'm going to have to take a day off of work for this. Do I really need it? And maybe they don't. Maybe, you can put something off for a few months in order to get them in a better financial situation, or they have some upcoming time off to cater to that or whatever it is. But I think really helps being able to individualize care and get to know your patients. And like Cole said, be able to talk to them uniquely in a way that they understand and fits their needs.
And you're meeting people where they're at. So, which I don't like about the healthcare system, we're trying to benchmark everything. Like, you only had this many people with A1Cs at goal, like, which is a blood sugar test that, you know, we use in diabetes to make sure, like, you know, we have blood sugars under control. You know, there's other things like you only got this many colonoscopies referred, and you know, only this percentage of your people. That's BS. All of that is BS in my mind. Obviously, we want people to do that stuff, but you have to meet them where they are. We're all humans. It's not my job to tell you what to do. And, you know, I think some people oh, they just told me you have to be on this medication. Like, you don't have to do anything, but here's your risk. Here's my recommendation. And you take that. We should be navigators, not telling people what to do. You know, I mean, if your arm's hanging on by a thread, I'm like, I would highly recommend that you go to the ER right now, or you get on an ambulance and you go do that. You can do whatever you want, though, you know.
But live your life.
Yeah,
join your
absolutely.
arm.
But when you don't meet people there, like, hey, you have diabetes and you don't want to treat it, that's fine.
Yeah.
Like, I am here. Like, I want to check that. Let's make sure it's not getting out of control. I'm here to help you if you don't, you know, I don't care if you want to or not. I'm here to help you if you want the help, you know. And I think once people start realizing that, you know, there's doctors and people out there like us that are, you know, we're trying to help, but at the same time, we're not going to force you to do anything, but we're here for you. And that's where I think that system is a failure, is because, you know, you're trying to quantify something that's not quantifiable. You're mixing numbers, you know, and unique bodies and unique minds all together and trying to get, it you know, it just doesn't work like that. So that's kind of where I'm at with taking care of patients. It's like, yeah, we should do this. Like, I know you don't want like big pharma, like statins, stuff like that. People have a lot against that stuff. I understand their feeling. I understand there are risks to medications, but where does the risk threshold end? And, you know, where are you more comfortable to be like, hey, like, you know, your cholesterol is super high. You have had 3 heart attacks in your family. Your blood pressure, we need to treat those things. I don't want you to end up like that either. You know, is the risk of maybe your blood sugar going up because of a statin higher than your cardiovascular risk? I don't think so. So maybe we should do that. But again, your decision. But it takes time to educate people on those things.
And so you started in what year? You started Flex Family Health in
2019.
And like you
April
guys
1st.
Oh,
that was a good idea. Yes.
And how have you
My staff
seen
loves
it,
that.
right? Because you're bringing this newer model to the Billings market, because you guys are in Laurel, so kind of Yellowstone County market. What was that like when you started it to where you all are now? Because you're in a different building, right?
Oh, we're still in the same one.
You're the same.
Yeah.
But kind of thinking of just where were you at that point to now where you are even staff wise? And are you part 2?
Oh, yeah.
Yeah.
Well, I mean, sorry, I don't want to speak for you here too much, Cole,
I'm talking too much anyways, so you need to talk more. But that's typical for our family.
It's really kind of a neat thing because it literally started with Cole in the clinic, you know, every day, just him. No nurse, no receptionist, just him taking care of everyone who walked through the door, answering all the phones, rooming people, doing vitals, and then doing, you know, the nurse practitioner provider thing. And now it's evolved into 8 staff, including you.
And it's clinical staff, which is not just like, staff. Entry level.
Right.
Those are like high, you know, profile.
Yeah, everyone's had some kind of
experience.
medical training, some kind of clinical training. Yeah. So I think you know, we opened in 2019. COVID started not long after.
But
it's not a bad business to be in COVID, you know, that it's I don't mean to sound callous saying that necessarily.
Right, but that's just the reality.
But that was just the reality, was that, you know, it kept him busy for sure and demanded that, you know, you step up and get even more staff during that time.
Well,
and people were realizing the value of the model during that time too.
Because we were out there doing things that no other doctor's offices were doing. You know, we were out there like, it was it was a difficult time because there's not a lot. We didn't know a lot. We didn't understand a lot. And we're just trying to go with what, you know, the information we're having. But it's like, I made, so we hired a physician before it was just me as a nurse practitioner and doing everything and drawing everybody's blood. And then we hired a physician, Dr. Fowler, who is our medical director as well now. But we were going out in the parking lot doing COVID swabs. People were, and the tough thing was too, is like people couldn't pay us because they were losing their jobs. And so we were losing people. It's like, well, just hold on. Like, we'll take care of you. I get it. I know you don't have a lot of funds right now. I get that. So we're just going to take care of you. It doesn't matter.
Yeah.
And we started making COVID tests like that. Like I bought some stuff out of Missoula, like the viral culture medium. We bought the tubes. We bought these swabs and we sent them to the state lab. And we were keeping people going with that, like testing, because everything was falling behind. So we were testing all the athletes at MSUB so they could go do stuff. We were testing like a bunch of, I can't remember what else we were doing, but it was crazy.
I think it was such a weird time. I look back and I'm like, ugh.
But we made it through, I think was the big thing, that where you were getting, but I feel like that was the cool thing for me, is that we are doing the things and we're making it work. And,
you're bringing a high value to people, and to the community by doing it the way you're doing it.
And you were in it and just trying to help people get through it in a hard time to now where we're at, where they're probably like, oh, they like helped us out during this. Like, I want to go back to them and support them.
Yeah. We were trying to help keep people open in businesses. Like, hey, we have to test. We have to do this. Like, this person's got a symptom. Like, bring them down. Like,
yep.
Yeah. The other cool thing is that with the clinic, with Flex Family Health, you partner with a lot of local businesses to provide memberships to their employees as a benefit. And so during COVID, especially, the businesses who they're partnering with really valued it, because Cole would go to their business and test all their employees before the shift that day, or, take care of employees, get them the PPE that they needed, that type of thing. And it's all as part of their service, being members to the clinic. And so being able to partner with businesses is just another value that they add to the community.
Which is nice as an employee too, like thinking of like, oh, like I have insurance probably through my employer, but they also care that I can maybe just connect with someone more routinely for this membership and be like, hi, I'm not feeling well or whatever.
Right, for sure. It helps with to keep your employees safe and healthy, right? And so people aren't missing work. That's not good for you as the employer or your employees, because they're missing out on part of their paycheck potentially.
Yep.
And the cool thing was that we came from that world, right? From my care, I came from that world where you were taking care of employees of a business, and they saw the value in it. So that trained me to like, hey, there is value as businesses using this. So we have 50, like around 50. I think it has ebbed and flowed a little bit, but we're around 50 companies in our clinic that use us from 5 to. I think Woods Power Grip now is one of our biggest ones. Woods Power Grip came on because they're the My Care Clinic. They lost the My Care Clinic in Laurel. It was going to cost them quite a bit more. So
we partner with Cole's Clinic and our employees. Knock on wood, all of our feedback's been great, and they appreciate it as a benefit, But so businesses large and small really are the only requirement is that 5 lives are covered under the business. So even if you're a sole proprietor, but you have a wife and 3 kids or whatever, you can sign up under our corporate membership plan and get a little bit of a break on your rates there.
Absolutely.
Which is nice.
And, if the cool thing is too, when that person leaves, they can still come and be part of our clinic, and I'll give them the rate of a business rate, which is, it's just $5 less a month, so $64 a month.
Which is nice.
Yeah. So I'm like, but I don't want to ever have that feeling where I can't just continue care for somebody, if they really want that. But the cool thing with this too is like, you don't have to offer insurance. You can just offer Flex Family Health, and we can do a great job for people like your employees, or you can have an insurance plus Flex Family. You can do all those things.
Totally.
And we'll do anything. We'll cater to people however we can meet them and take care of people.
More of the concierge type service.
Yeah.
A little, to an extent, right? Where it's like they can call you and work things out that works for their, like what works for Woods, right? Is there more employees than maybe the small shop that has 6 people.
Right.
I guess,
we kind of customize arrangements with businesses. Like some businesses like to cover the entire membership cost themselves as a benefit to their employees. Others maybe offer it to their employees as like a 50-50 cost share
Yeah,
thing.
which is
And some say, hey, we have this relationship with this business and you have the option to opt into it as part of your employment here. It's going to cost you. You're going to have a payroll deduction for it, but it's a great benefit. It's a health benefit for you, so to say.
Mm-hmm. Yeah. And the only reason I kind of cringe at concierge.
I know, I'm sorry. It was
No.
like a word, but I was
Well,
like, I mean, like,
I know where you're coming from business, but
Yeah.
in healthcare, like when we talk about concierge medicine, it's very like high profile. It's very like, it's a membership fee, but it's like exorbitant. Like it's $500 a month to have like this doctor, and you have like really high profile people where direct primary care is like concierge for the masses. So that's the only, but I get where you're coming from with the business.
I'm glad we clicked, because I think, if people are listening and they are in healthcare, they're like, what?
Yeah,
What?
right.
Yeah.
But I think it's one of those things where, I definitely, you can do so many different things. You can cater to people however you want to do it, and you take care of people all the same then too. Like everyone's like, there's everyone's getting the same treatment, everyone gets the same time, it's a great way to do it. And I hope it's the future of what we're doing in the United States. And I'm the president of the Montana Direct Patient Care Association. So there's a bunch of these clinics popping up around the state. We've done a lot with the legislature to, one, make sure we're legitimized, with the state, the insurance commission and stuff like that.
Education's
to make sure,
huge.
so people know that we are a legit type of clinic, even though we shouldn't have to do that, but you got to protect yourself from insurance companies and stuff like that too, because, sometimes that can get sticky. But we do that. So, and we've passed laws and stuff like that where it allows us to dispense medications from our clinic. So the cool thing with that is like, hey, I have that medicine in my clinic and it costs 3 cents a pill. So you're going to pay 90 cents for 30 days of blood pressure medicine, which is, it's great. And, I tell people like, like I'm getting kickbacks, all right, on this, but like it's 15%. I'm just marking it up. So I make, was 15%. And I make 12
Not
cents.
Like 300%.
Right.
Yeah.
So,
do you know what I mean? Yeah.
And they're all on our website. We advertise all those prices and things like that. So, I think that's what we just need more of in healthcare is transparency. We need more of that because I want to know what I'm paying for. Like if I went to a restaurant around here and I paid for a cheeseburger, or I ordered a cheeseburger, but I couldn't see how much the cost was.
Yeah.
I'd be like, well, like I'd like to know what I'm getting,
And like, how much is this burger going to cost me? Really?
Yeah. And is it good? Right.
Quality.
Restaurant because I can go to that one and get a cheeseburger and I know what I'm paying.
Yeah. But I think we just don't have that. And so, we're very transparent about that, and that's the cool thing with making these laws and stuff like that is we have the capability to make everything more transparent. So we can make our prescription prices more transparent.
Yep.
We can,
Wouldn't that be interesting to see?
Oh yeah. Well, you can go on our website and look at how much they cost, and then you can, go on GoodRx or something and look at the discount, and we usually beat their discounts on those things even. But you can see retail prices of those, but there's just it's not transparent, and I think people are trying to make money off of healthcare of people, which I think is wrong. I mean, ethically, I didn't get into this to make a ton of money. Like, I want to make a good living and I want to do that, but I don't need to take money from people because, from their health.
You guys are like giving back and providing a great service, but really involved in the community too, which is great. Yeah.
Sorry, I got off on a little tangent there.
No, it's good. Keep going if you want. Yeah.
I definitely, I'm very passionate about what I do. I just feel like there's so many different facets of healthcare that a lot of people like, I want to tell you, like, this is what healthcare is like. This is what it should be like. And this is what you deserve. Not like, this is what you get, right? You deserve
quality healthcare.
And the whole debate of, is healthcare a right or is healthcare a, that whole discussion? Well, it can be both. Like, absolutely. I want you to be healthy. Like, you have to put some into it, right? Everybody, if you want to be healthy, you have to put some stake in the game. Is it a right? I don't know, because if you don't exercise, you don't do those things, like, you have to will some of it. But at the same time, we should make it affordable and teach people, right? I think it's all about education on that too. So let's make it affordable. Let's teach people you know, and
Yeah, give them
sometimes
all the right tools to
Yeah.
succeed, right?
Yeah, and
just
help
like with
them.
anything else. And
so
but,
I think that discussion of the right of healthcare and stuff like that, like, is very wrong. We're not approaching it correctly. And that's, I mean, just my opinion.
Yeah.
Obviously we all get dealt our cards, and sometimes our cards are terrible.
Yeah.
Which that sucks. But you know, I think it's one of those things where we need people like me, not saying, I'm not trying to pump me, like,
well,
say, oh yeah.
but flex,
Yeah.
like,
But I mean, we
things like
need,
flex family health. Yeah.
and we need, so, you know, I'll plug Joe Pela. He's does direct primary care here. Well, he does direct internal medicine in Billings. You know, I'm always like, hey Joe, do you need help? He's like, no, he's got it. He's a great dude. And then Robert Wagner, PearlMed, same thing.
Okay.
I'm like, hey, do you need help? Let's get more people like us. I'm always talking to people that want to try to do this in town, because I'm like, this needs to be the thing, you know. The rising tides raise all ships, right?
Well,
But-
to have a network across the state too, right? Because maybe they're like traveling and they're like, I really need to see you, but I'm like in the Flathead for
Yeah.
a week.
Oh.
Like, who do you know up here that I can go? You know, so
We're
I
always
think that
calling each
network
other.
is huge.
When I first started, I had a patient that was traveling in New York, and she had like an exacerbation of COPD, or chronic obstructive pulmonary disease. And I was like, okay, like, let me make a call. Like, she doesn't have insurance. She doesn't have a lot of money. I'm like, okay, let me called like 3 different doctors, got a hold of one. He's like, yeah, I can get her in, do that. He's like, you know, I'll have to charge her, you know, a fee to see me, but it would be like $100 or something like that. I'm like, I think she can make that work. Got it. You know, got her treatment, stuff like that. He let me know, got her back. You know, that's what we do. And then in Montana, yeah, super easy. Anybody else in this state would be happy to help one of our traveling patients, usually for no cost. I will absolutely, you know, take care of somebody from, you know, Cost Care in Missoula, or Peer DPC in Polson for nothing. Like, just be like, yeah, they're traveling. Like, I'll help. We're all part of this together. And I think if we have more of this, I mean, we only take 500 to 600 patients per provider. At like the hospitals, you take 2,000 to 3,000 patients. It's
That's
hard
some
to do a good
interesting
job.
Math.
Yeah.
I'm not a math person,
Sure.
so I'm sure people that are listening that are math people can do that math in their
Right,
head, but
right.
not me.
2,000
Yeah.
to 3,000. Like, how many patients you have to see a day?
Per
Like,
person,
yeah,
that's
like,
a lot.
and if you have sick people, you got to see them. Like,
You
okay,
only
like,
work,
so
like, 3
you,
days,
yeah,
yeah.
like, yeah. Oh God. So
yeah,
yeah,
it's a lot.
Yeah.
So it's absolutely like imperative that we push this model to everybody else too. But it's hard. I mean, people have loans. It's hard to pay off your loans when you're starting up a business. It's hard to where, you know, you can get your loans paid back if you are on for so long somewhere, you know. So, you know, it's difficult to do that, you know. It's, you know, one of those things where it's not right for everybody. Not everybody, you know, Katie and I are very lucky to be, or we've had good parents or something where, you know, we're able to talk to other people, and, you know, but some people are just like medically minded. Like, then some of the other stuff, like talking to people, doesn't necessarily come.
Right. Maybe like some of the other things that come along with being a business owner, right? Like doing some marketing or like learning everything there is to know about
Like
the financials and
yeah.
that kind of stuff doesn't always come naturally, or can be super intimidating to people, which I totally get.
Yeah.
But Big Say Economic Development, I'm gonna plug you guys for a second, just because
thanks.
it's awesome. I'm just, after this, remind me to go see Keith. I got to sign up for my little membership,
great.
$49 a month to have space here. My clinic's very small right now, so I sit at the front desk. I say hi to people. Like, I can't get a lot done. I work at the youth detention center down here on the side. So like, I have to go back and forth a lot. So this is like right in the middle, and it's great. Like,
I'll buy.
so $49 a month, I can have a quiet place to work and do that. So if anybody, you know,
Come
wants
down to Rock 31.
yeah, if they want to set up a meeting with me to chat, like a doctor or something, someone's
Or
listening,
business.
or business or something like that wants more information, happy to set up that. But I think that's great that you guys offer that too. And so, you know, I would love to use that to be a place to meet with people in the community to help them, you know, develop their business as far as their medical business, or help them take care of their employees by using a direct primary care clinic. Does it have to be me? No, I would like it to be me, but at the same time, I don't want to have a monopoly on healthcare. I want people to get it and use the people that they like. You know, my personality, I'm a little bit like, like, Some people like,
all over
some people are very quiet, Yeah.
It takes all kinds. And I think you guys are just doing really great things. And it's been fun to watch both of you. Cause I remember I remember hearing about Flex Family Health when you guys started and to see where you're at now. You transitioned us nicely. Where can people get a hold of you, get connected with you guys and learn more about Flex Family Health? I know at some point you'll start to be down here sometimes, but in the meantime.
Yeah, absolutely. Katie's kind of the guru on some of that stuff.
Oh, well, I mean, obviously we have like a website.
Yeah, what's
flexfamilyhealth.com. Pretty simple. All in one word, no dashes, no dots, none of that kind of stuff. So flexfamilyhealth.com. We have a social media, Facebook, Instagram. I have to admit that it is something that gets put on the back burner just in the midst of life. So sometimes it's really active and there's a lot of posts on there, and other times it is a little silent at times. But regardless, if you reach out through any of those, we'll get a hold of you. And then we have a phone number, 406-894-2425. So those are all great ways to reach out. Just reach out to Marcel. She'll connect you.
I'll connect you. Yeah, if you need it too. So, but the website I think is a great place to get started.
There's a ton of information on there. We'd like to think that it's built in a super user-friendly way, but we are not website developers.
Technology is always evolving. I'm like, it's crazy.
Right. So get a hold of us. Happy to chat. Share experiences or information.
Yep.
Thanks for coming on.
Here at this space.
Come to Rock 31. See Cole. Katie's here too for different things.
I'm usually in and out a few times a year.
I see you. Once in a while. Yeah. Well, thank you both for coming on the vault and sharing your story.
Marcel. Yeah, it's been great. Yeah. Thank you.
Thanks. Thanks for listening to The Vault. Connect with us on Facebook at The Vault at 201 North Broadway or Instagram at TheVault_201. Or check us out on our website, thevault@201.com, where you can subscribe to our weekly newsletter. See you next time.